Hello everyone, this is Yoshiko Yamaguchi from Kasui Women's University, Japan. I am so pleased to have an opportunity to present a part of our research in this international conference. Today, I will talk about nurses' mental health. Regarding employees' mental health, work-related factors such as work overload or work condition factors, for example, long working hours are often focused by researchers. So in this study, we tried to examine effect of family-related factors. For example, if the relationship between family members each other is unsatisfied, one's mental health would deteriorate. Family-related factors such as above, family members' relationship or family care overload, challenging care or elder parents' care would affect one's mental health status. Anyway, what is mental health? I know, of course, everyone would have already been known what is mental health. But ahead of my presentation, I would like to make sure its definition. Defining mental health GLB is that mental health includes our emotional, psychological, and social well-being. It affects how we think, feel, and act. It also helps determine how we handle stress, relate to others, and make choice. Mental health is important at every stage of life, from childhood and adolescence through adulthood. So it means that definitely good mental health status is needed for everyone for better performing in their work life. In this study, among numerous occupations, we especially attention to nurses' mental health and its affecting factors. Nurses are predominant healthcare workers in the world and delegated to the robust role of maintaining or promoting people's health. So nurses are definitely important occupation to keep people's health status. Therefore, nurses are also required to maintain good health status themselves for providing good performance. However, regrettably, and several studies reported that nurses' poor mental health status. The problem that poor mental health status of nurses not only associate to their low performance, but also causes to the occurrence of occasional medical errors or concern about impeding patient safety. Obviously, it's important to create effective support to make nurses' mental health status improve. Thus, we conducted this study to examine what is affect nurses' mental health. We expect this study result will relate to creating effective support for improving nurses' mental health. In extent previous research regarding predictors of nurses' mental health, high job stress deteriorates the mental health of nurses. Job stress includes low workload, low insufficiency, low ambiguity, low limit, responsibility, the physical environment, high psychological job demand, low job control, and low job support. On the other hand, regarding family-related factors, burden of child-rearing load overload, family-related stress impede nurses' mental health status. The most representative studied stress factors relating work and family is concept of work-family conflict. Work-family conflict arises from competing responsibilities to work and family. It is composed of work interference with family and family interference with work. Work-family conflict negatively impact nurses' mental health. Therefore, nurses' mental health status is influenced by both work and family-related stress. Occupation of nurses has distinguished characteristics. This is that majority are women. Even recently, the number of male nurses increased in the world. Nurses still women predominant occupation, so we suppose nurses would perceive their family task overload. Referring one study from South Africa has reported that personal stress, which included family-related stress, predicts nurses' mental health status more than their work stress. Therefore, we created the first research question which has a greater impact, work stress or family-related stress, to nurses' mental health status. Next, we focus on nurses' age and their workplace. The burden of family demand varies among nurses of different ages. Young nurses aged 30 to 40 are often responsible for caring for their children, whereas nurses aged over 50 do not require long periods for childcare. At present, nurses work in a range of healthcare settings, such as public health, home health care, or as nursing residents. Most graduate nurses' primary workplace are hospital. However, as home healthcare nurses are required to have more nursing experience when they begin providing home health care. Their mean age is older than that of hospital nurses. Moreover, several nurses who previously worked in hospital find employment at nursing homes and therefore tend to be older than hospital nurses. In Japan, nurses often change their workplace with considering balancing their family tasks. For example, after delivering the baby, nurses will move to daily work from night shift, from hospital to outpatient clinic. Different age of nurses as per workplace would be attributed to nurses' family role task changing along with their generation. Nurses' generation varied among the healthcare settings, which may explain the difference in nurses' family-related stress level between healthcare settings. Thus, we esteemed different would exist nurses' mental health in between hospital, home health care, and nursing homes. Along the mentioning background, we generated the following study purpose. The purpose of this study is to clarify the impact and magnitude of both job and family-related stress to nurses' mental health status and to examine whether the difference exists nurses' mental health level by nurses' workplace. This shows the hypothesis of this research. We assumed that nurses' mental health predicted by relation between work stress, family-related stress, and workplace characteristics, which included nurses' age, generation. Data are collected from nurses working at hospital, in home health care, and nursing homes in the Kyushu district of Japan. We analyzed 1,461 varied questionnaires. The breakdown of it was 596, 408, and 457 were hospital nurses, home healthcare nurses, and nursing home nurses, respectively. We achieved to get required equal samples for comparative surveying. We measured target nurses' work or family-related stress factors and their demographic as independent variables. Then we also measured their mental health status with using Japanese version of GHQ-12, which as dependent variables. We use statistical analysis for examining our research question. First, we use one-way ANOVA to compare the level of mental health status among three groups: hospital, home health care, and nursing homes. Next, we applied hierarchical regression analysis to clarify the impact and magnitude of both job and family-related stress to nurses' mental health status. Next is result. Regarding each workplace nurse's characteristics, hospital nurses were younger than home health care and nursing home nurses, and more part-time nurses worked in home health care than in hospital and nursing homes, and more enrolled nurses work in nursing homes than in hospital or home health care. The mental health level was different among these three groups. Hospital nurses showed the highest GHQ score. It means that hospital nurses indicated worse mental health status among these three groups. Contrary, hospital nurses, home healthcare nurses pointed out lowest GHQ score. It means that the group of home healthcare nurses has the most healthy mental health. Referring the result of regression analysis of entire nurses, both job and family stress variables showed similar coefficients of determination. Nevertheless, both work and family stress factors have similar impact to nurses' mental health status. The strongest prediction was job demand, followed by job control. This implies that nurses' mental health status can be predicted by their job status. Implication for practice. Both job and family-related stress were shown to affect nurses' mental health status. However, job demand, one of work stress, was shown to be the most obstructive factor for nurses' mental health. It's indicating that reducing nurses' work stress, job demand may be the most effective intervention for improving the mental health status of nurses. If nursing manager could adjust workload for each nurse and unify the instruction system for each nursing team, it may effectively improve nurses' mental health status. Hospital nurses' mental health level was worse, so this intervention should be urgently fulfilled for hospital nurses. Thank you for your kind attention. Thank you very much.